Are you over 60 and often wake up with lower back pain? Don't assume it's just a normal sign of aging. With one simple wall-supported movement, you can help your spine relax, strengthen your back muscles, and reduce morning stiffness. As we age, the muscles in the back and abdomen gradually weaken. This can place extra pressure on the lower back, leading to discomfort and reduced mobility. This gentle exercise helps activate the muscles that support the spine, improve posture, and make movement easier, without the need for any equipment. Just a few minutes each day can make a big difference for your back health. If you find this video helpful, subscribe to the channel for more simple and safe exercises designed for older adults. Biceps. Have you ever noticed that many people over 60 often feel more lower back stiffness in the morning? Some people feel their back tighten just from bending down to tie their shoes. Or when standing up from a chair, they need a few seconds before they feel steady. This is actually very common. As we age, the muscle groups that support the spine, such as the back, abdominal, and shoulder muscles, gradually weaken. Over time, the spine has to handle more pressure, and the lower back can start to feel sore and fatigued. Interestingly, the cause is not always just the back itself. Weak chest and arm muscles can pull the body forward, which forces the lower spine to work harder to keep the body balanced. That's why gentle exercises that activate the upper body can help reduce pressure on the lower back. Wall push-ups are one of the simplest yet most helpful movements. You don't need to lie on the floor or use any equipment, just a sturdy wall at home. When performing this movement, the chest, shoulder, and arm muscles are gently activated. At the same time, the abdominal and back muscles engage to keep the body stable. As a result, the spine gets better support, posture gradually improves, and the tension in the lower back may decrease over time. The movement itself is simple. Stand facing a wall, about an arm's length away. Place both hands on the wall at shoulder height. Keep your back straight, and relax your shoulders. Slowly bend your elbows and bring your chest closer to the wall. Breathe in gently as you lower your body. As you push yourself back to the starting position, breathe out slowly. The key is to keep your body straight from your head to your heels without arching your back or shrugging your shoulders. You can start with about 8 to 10 repetitions each morning. If your body feels comfortable, you can gradually increase the number after a few weeks. The movement does not need to be fast, just slow and consistent. Sometimes, just a few minutes a day can help your body feel more flexible and make your lower back less stiff as you begin the day. Biceps. Have you ever wondered why sometimes even stepping onto a small curb or climbing a few stairs can make your lower back feel uncomfortable? Many people over 60 notice that their legs no longer lift as easily as they used to. While walking, the foot may lightly drag on the floor, or they may need to look down to make sure they don't trip over something. This is actually quite common. The hip muscles, thigh muscles, and the muscles responsible for balance gradually weaken over time, making body movements slower and less flexible. When the muscles in the hips and legs are not working well, the lower spine often has to take on the extra job of stabilizing the body. Because of this, every step, every time you stand up, or every time you turn your body can place additional pressure on the lower back. Over time, the lower back can begin to feel tired and sore, especially in the morning when the body is just starting to move. A very simple movement that can help improve this is the wall knee raise exercise. This exercise is similar to walking in place, but slower and more controlled. When you lift your knee, the hip and thigh muscles are activated, while the standing leg works to keep your body balanced. This helps improve your control of leg movement. As a result, walking can become steadier and unnecessary pressure on the lower back may gradually decrease. To perform the exercise, stand close to a wall. Lightly place your fingertips on the wall for balance. There is no need to lean heavily on it. Keep your back straight and your shoulders relaxed. Then slowly lift one knee, bringing it up to about hip height, or as high as feels comfortable. Hold the position for 1 or 2 seconds. Then gently lower your foot back down. After that, switch to the other leg. The key is to move slowly. There is no need to lift the knee too high or too quickly. You can imagine yourself walking slowly in a gentle parade. Let your body feel each movement. You can start with about 30 to 60 seconds each morning. As your body becomes more familiar with the movement, lifting your knees will feel easier and your steps may become steadier. Sometimes a small movement like this can help your body feel more flexible and allow your lower back to carry less strain during everyday activities. Biceps. Have you ever noticed that when standing for a long time, walking downhill, or stepping down stairs, the lower back and knees often start to feel tired first? Many people over 60 say their legs feel weaker, almost as if their knees no longer support the body as firmly as before. Sometimes even standing in the kitchen or waiting in line for a few minutes can make the legs tremble slightly and the lower back tighten. This usually isn't a sign that you've done something wrong. It's often simply because the muscles that support the knees and spine gradually weaken over time. When the thigh muscles, especially the quadriceps, are not strong enough, more of the body's weight shifts onto the knee joints and the lower back. The spine then has to work harder to keep the body balanced. Because of this, every step you take or every time you sit down and stand up can place additional pressure on the lower back. A gentle but effective movement that can help support this area is the wall-supported, imaginary chair exercise. Commonly called the wall sit. One of the benefits of this exercise is that it activates the thigh muscles strongly without requiring much movement. Your back is supported by the wall, so the spine is not overloaded. As the thigh muscles become stronger, they help share the workload with the lower back, reducing pressure on both the lumbar spine and the knees. To perform the exercise, stand with your back against a wall, making sure your back and shoulders are touching the wall surface. Step your feet forward about 12 to 16 inches, 30 to 40 centimeters. With your feet about hip width apart, slowly slide your back down the wall as if you are sitting on an invisible chair. There is no need to go too low. Just lower yourself to a level that feels comfortable. Once in the seated position, keep your back flat against the wall and breathe steadily. You can start by holding the position for about 10 to 15 seconds. As your body becomes more comfortable, you may increase it to 20 or 30 seconds. If your thighs start to feel warm or slightly shaky, that is often just a sign that the muscles are being activated. After holding the position long enough, gently press your hands against the wall to help yourself stand back up. Repeat the exercise about 2 to 3 times each morning. There's no need to rush. Moving slowly and consistently often feels safer and more comfortable for the body. Over time, many people notice that their legs feel stronger and their lower back becomes less tired during everyday activities. Biceps. Have you ever noticed a very small moment in everyday life? The moment of standing up from a chair. When we were younger, we barely thought about it. But after the age of 60, many people begin to realize that standing up from a sofa, a dining chair, or a low seat sometimes takes a little more time. Some may even need to push with their hands before they feel stable. This is a very common experience, and many people also feel a bit of tension in the lower back when doing this movement. This often happens because large muscle groups, such as the thighs and glutes, gradually weaken over time. When these muscles are no longer strong enough, the spine, especially the lower back, has to take on extra work to help the body stand up. As a result, even a simple movement like rising from a chair can make the lower back feel tired or tight. That's why the sit-to-stand exercise is often recommended by movement specialists for older adults. It closely mirrors a daily activity, so the body adapts to it easily. When you perform this movement, the thigh muscles, glutes, and abdominal muscles work together to lift the body. These muscles act like the main engine that reduces the workload on the spine. As they become stronger, standing up, sitting down, and moving around the house can feel easier, while the lower back experiences less strain. To begin, place a sturdy chair against a wall so it doesn't slide. Stand in front of the chair with your feet about shoulder width apart. When preparing to sit down, slowly lower your body onto the chair rather than dropping down quickly. You can slowly count from 1 to 3 to control the movement. Sitting down slowly helps activate the thigh and glute muscles more effectively. Once you are seated, lean your body slightly forward. Shift your weight into your heels. Then slowly stand up. If you need to place your hands on your thighs for support at first, that is completely normal. As your body becomes stronger, you can try standing up without using your hands. You can start with about 5 repetitions each morning. There is no need to move quickly, just slow and controlled. Over time, many people notice that standing up from a chair becomes easier. Their steps feel steadier, and the lower back feels less strained during daily activities. Biceps. Have you ever felt your legs becoming heavier toward the end of the day? Especially around the calves and ankles? Many people over 60 say that sometimes even a short walk can make their legs feel tired. Or they may feel slightly unsteady when stepping up onto a curb. Some also notice that when they try to walk faster, their feet no longer respond as quickly or smoothly as before. These small changes often happen so gradually that many people barely notice them at first. In fact, the calf muscles play a very important role in helping the body maintain balance and support blood circulation. The calf muscles are often called the body's second heart because they help pump blood from the legs back toward the heart when we move. When these muscles become weaker, blood circulation can slow down, which may make the legs feel heavy, tired, or slightly swollen. At the same time, the ankle's ability to react quickly during movement may decrease, increasing the risk of losing balance and sometimes causing the lower back to tense up in order to stabilize the body. A simple movement that can help improve this is the heel raise exercise. It's a gentle exercise but very effective at activating the muscles in the calves and ankles. When the calves become stronger, maintaining balance while standing, walking, or turning becomes easier. This can also indirectly reduce unnecessary pressure on the spine and lower back. To perform the exercise, stand near a wall or a sturdy table. Lightly place your hands on the wall for balance. Keep your feet about hip width apart and stand tall. Then slowly lift your heels off the ground, raising your body onto the balls of your feet. Move slowly and try to feel your calf muscles contracting. When you reach your highest comfortable point, hold the position for about 1 to 2 seconds. Then slowly lower your heels back down without dropping them quickly. The lowering phase is just as important because it helps the muscles work more effectively. You can start with about 10 repetitions per set and perform 2 sets each morning. If your calves feel slightly warm or mildly tight, that is usually just a sign that the muscles are being activated. Practicing this regularly each day can help your legs feel more flexible. Your steps become steadier, and your body feel more stable during everyday activities. Biceps. Before we finish, I'd like to share a small message with you. Age may change many things, but caring for your body each day is still within your control. Just a few minutes of gentle movement in the morning can help your body stay flexible, reduce aches and stiffness, and help you begin the day with more energy. What matters most is not exercising longer or harder, but staying consistent and listening to your body. If you found the exercises in this video helpful, please take a moment to like the video and subscribe to the channel so you don't miss the next ones. This channel regularly shares simple, safe exercises designed for older adults to help improve health and keep the body moving every day. You can also share this video with family members, friends, or your parents. Sometimes a small exercise can make a real difference and help someone feel stronger and more confident in their daily life. Thank you for watching, and I look forward to seeing you in the next video. Biceps.